good afternoon. My name is Bridgett. I'm one of the nurses here at the clinic.
And I'm Missy. I'm also one of the nurses.
And we're just gonna come and assess your son, William Paul here. Could we have you verify his full name and date of birth for us?
William James Paul, 12/14/24.
Beautiful, beautiful. Okie dokie. So, any allergies that we need to be aware of?
No, not that I know of.
All right, I'm just gonna go ahead. I'm gonna go ahead around this side and get this back. And then I'm just gonna kind of do a head to toe. Cause what brought you guys in today?
He's been having a little bit of trouble. We got a little bit anxious since his sickle cell diagnosis, and we're still kind of learning what we're supposed to be looking for. He's been a little bit more fussy the last couple of days, so we just kind of want to make sure that everything's all right.
Yeah, that's totally understandable. You guys are doing such a great job by being so observant. So let's just take a look at him, okay?
Okay.
Okay. So I'm gonna go ahead and look at your head. Little cutie patootie. And look at that head of hair. Woo!
Didn't get it from his daddy.
Okay. So the fontanelle is soft and flat, which is a good sign because if it was sunken in, that could be a sign of dehydration. His eyes are clear and bright. His mouth, shining in the light, looks moist. So he's staying hydrated. So good job, good job. But the skin looks a little pale, which can happen with sickle cell disease. Have you guys noticed any swelling in his hands or feet lately?
Actually, yeah. His fingers were a little puffy a couple days ago. Didn't really last long, and he's been sleeping a little bit more and kind of breathing rapidly, panting like our dog.
Oh, okay. So, that could be a mild episode of dactylitis, which is severe swelling of those hands and feet.
Oh, no.
And it's very common with infants with sickle cell disease. It can be painful, but it can be manageable too. So I'm just gonna go ahead and do a pain assessment by using the FLAC pain scale.
What's that?
So I'm gonna be looking at his face, see if he's grimacing at all, and then I'm gonna look at his legs to see if they're like kind of clenched into his body, which they're a little bit, and he's kind of grimacing a little bit, but I'm also messing with him a lot. And then the A would be activity, so if he's moving about at all, or he's just kind of staying still.
Okay.
And then if he's crying at all, which he's not crying yet, and then if he's able to be consoled, so, but he's chilling, he's just a little tense, so I would say he has some mild discomfort going on right now.
Okay.
So what we can do for that mild discomfort would be some interventions that Missy will go through with you guys. Just gonna put this little hat back on.
So, when he's having some mild pain and discomfort, what we can do is give Tylenol. You're gonna give it according to his body weight, and that'll say on the bottle how much he should get. You can also use warm compresses on any swollen and painful areas like his hands and his feet. And then we're going to keep up with frequent feedings to make sure he stays hydrated. The more dehydrated he gets, the more at risk he is for having more pain. And then we're going to monitor his temperature every day. If it gets above 100.4, then you'll need to go to the ER. It's a big red flag in sickle cell patients. If they get a fever, that there's an infection brewing somewhere.
Oh no. Well, we've been checking his temperature twice a day so far, and he's had no fever. And we're giving him extra formula. He seems hungry all the time.
That's perfect. Staying hydrated helps prevent a pain crisis. Formula and breast milk are great when he's this little, and as he grows more, then we'll talk about adding more fluids as is safe.
Hi, I'm another nurse. I'm kind of going to talk about a little bit of the planning and education here. My name is Jade. So I just want to review a few important things to kind of look at. The signs of dehydration, signs of pain, using that FLAC tool you guys talked about earlier, correct?
Yep, we remember a little bit about that.
Okay, so for the dehydration, we're gonna look for fewer wet diapers. He has a dry mouth, or like that sunken soft spot on the top of his head. And then the FLAC tool, we want to look for changes in his face, his activity, or how easily he calms. If you just can't get him to calm down, you kind of want to pay a little bit of attention to that, okay?
Is there anything else we should watch for?
Another thing to look for is the hands and swelling in the feet. I noticed earlier that you had mentioned that he had that. So kind of paying attention to that, making sure that's not happening anymore. If it does, kind of report it to the doctor. Unusual fatigue, he's getting a little bit tired too quick. And then if his skin starts getting really pale or you see it kind of yellowing, that could be a sign of jaundice, so he needs to come in and get seen so we can kind of check him out a little bit more too. Any signs of infection or fever as well, so making sure that fever doesn't get above 100.4. If it does, you want to call and come in right away so we can start getting a handle on things. If anything does feel off, don't hesitate to call. You guys know him the best, so we kind of want to make sure we're paying attention to all that, okay?
Okie dokie.
So I do want to go through a few things with you guys as well. Are you guys able to tell me some more signs or any early signs of dehydration and pain and what you're kind of looking for with that?
I think some signs of dehydration would be little to no wet diapers, sunken soft spot, and I'm trying to think of some more. I think those are all I remember.
Those are the big ones, just looking for those diapers and stuff. That's a big thing to look at when you're having a little one like this. And then what are some reasons you guys should be seeking some medical care, making sure that he's all safe as well?
If he has a temperature of 100.4, we should be bringing him in. And how are we supposed to take that?
You could do his temperature in his armpit as an option. The best way when they're this young is a rectal temperature. I know a lot of people are uncomfortable with that, so while you're at home with him, I would recommend doing one in his armpit if that works. Just kind of put it in there and hold his arm down until you get an accurate reading, okay?
Okay, thank you.
Do you guys have any other questions or anything for me right now before I go through a little demonstration with you guys?
No.
No? Okay. So I am going to kind of show you a few things over here, Mom and Dad. So like you know, sickle cell has good red blood cells and bad red blood cells. I kind of brought a bigger demonstration of a normal red blood cell, circular, round. It would go through the vein very easily. It's not going to get kind of stuck or anything like that. And then a sickle cell is what he has. Kind of looks like this crescent moon shape. It's going to kind of sit like this, and it's a little stickier. It gets a little bit more stuck in the vein, and it tends to cause issues that way. A little bit more pain. Everything's trying to get through there. So we have a demonstration to kind of help just you guys visualize this a little bit more and feel more comfortable understanding what is going on here. So when you have this normal cell going through here, it's going to go through really nice and roll through, and then roll through the other way. The sickle cells tend to get stuck on each other and kind of wedge into those capillaries. So as I'm shaking, it's getting hard for it to go through. There we go. So as they're all in there together, they're going to kind of clump together, and it's just going to make it really difficult to go through this entire vein. So as you get more and more, they kind of wedge itself, and then they don't get through. They just are very, very sticky. I also brought for you this pamphlet. It goes through all of the different signs and symptoms, things to look for. It kind of talks to you about what sickle cell is as a whole, how it's an inherited disease, and then the shape of the sickle cell makes it hard for the flow of blood to go through the vessels, and it just makes it a lot more difficult. Signs and symptoms, episodes of severe pain, so he kind of said looking at his face, if he's able to get calmed and stuff like that. If, obviously he's too young to notice if he's having vision problems right now, but looking at that skin to make sure his skin is not yellowing, he's not super duper pale. Hands and feet are swelling. If you kind of feel over his tongue a little bit and he starts yelling or anything like that, abdominal pain, just kind of looking at that. I also do want to make you aware of some potential complications. I know they can be a little bit scary, but it is important to understand what they look like. So you can have a sickle cell crisis, a stroke, which is unlikely, but it could happen. He is at an increased risk for dehydration, so pay attention to making sure that his mouth is moisturized and making sure he's good that way. Gallstones as well, and there's a potential for blindness if you don't treat him well or take care of him. And then treatment, a big one is a bone marrow transplant to kind of revamp those cells because your red blood cells do come from the bone marrow. Blood transfusions to kind of get more good red blood cells in there and dilute the sickle cells almost. And then different medications. There's more information on the back. Big thing for him as he gets older is staying up to date with all of your vaccines and making sure he's doing low impact sports when it gets to that time, and limit his exposure to extreme temperatures. You also want a nutrient-rich diet, which right now he is breastfeeding or doing formula, so those are both really good options for him at this point, and an adequate fluid intake when he actually can start drinking water. Other than that, do you have any questions or concerns for me?
No, but we can keep that.
Yep, I will give this to you. I'll put it in your folder of all your guys' information and make sure you guys are all caught up, okay?
Okay, awesome. Thank you.
That's a lot, but it helps us feel more in control.
I'm so happy it helps you guys feel more in control. Have a good day.
You too.
Thank you.